Hello, this is Dr. Gabe from First Look MRI, and this is a 24-year-old male who fell from a ladder about a week ago. Has had radial-sided wrist pain. He went to see the orthopedic surgeon who did x-rays, and the x-rays showed no displaced fracture. But the pain was in the radial aspect of the wrist, and we're really worried about this bone right here. This is called the scaphoid bone. This is the scaphoid bone. And the scaphoid bone, sometimes you can have a fracture that is occult, where we just don't see it because there's no bone displacement. And if they do have a fracture, there's a blood supply that's unique to the scaphoid bone. Normally blood flows from the heart distally, into the hand and to the fingers. But this bone, the blood supply goes from distal to here, then it comes back proximally to the proximal scaphoid. So if the blood supply is disrupted from a fracture of the scaphoid anywhere, then this part of the bone can have vascular compromise and die, and they call that avascular necrosis. So in a case like this, where we have a normal x-ray with no evidence of a fracture, and they have pain when the doctor pushes in this region, they may still have clinical suspicion for an occult fracture, and so they ordered an MRI, and on the MRI we see this. This is a T1 weighted view where marrow is bright, normal marrow. Here we have an area of darkness right in the middle of the scaphoid, the mid-pole of the scaphoid, and this is a non-displaced fracture that is invisible on x-ray. There's no bone displacement, so it just doesn't show up on x-ray. All we see is the marrow change. So this is a view where fat is suppressed and bone injuries show up as bright. And we see here this light bulb bright area right in the middle. And this is again marrow edema where there's trabecular microfracture through here, a non-displaced fracture. But again, the cortex is intact. There's no displaced fracture, and that's why it was invisible on the x-rays. But this is again a critical finding because now that we know that there's a fracture, they need to prevent the avascular necrosis of the proximal pole here. So they're going to go ahead and put a splint on the patient or a light cast, and they can go on to hopefully heal up perfectly fine. But if they didn't do that, they would be at risk to injure the vessels and then cause avascular necrosis, which can be devastating. So a case of a non-displaced fracture of the midpole of the scaphoid, a critical finding, and again, without MRI, it would be hard to make this diagnosis. Thank you very much.